So good afternoon, everyone, and welcome to Member Cafe. So glad you could join us today. We're going to wait just a few moments to get started while everyone gets logged in. All right, so our numbers are slowing down, so I'm going to go ahead and get started. Good afternoon. My name is Ann Gluff, and I am part of the member engagement team here at Partners Health Management. We are so happy that you have joined us today to learn more about our advisory committees. But before we get started, let me go ahead and introduce everyone on our panel here, the gallery that you see in front of you right now. So joining us from the member engagement team to help our session run nice and smooth today, besides myself, is Beth Brooks. She is our Zoom guru. She's going to make sure everything runs nice and smooth. And then also Stacy Lawrence, member engagement specialist. She'll be sharing some information with you in the chat. And Cindy Trobaugh, member engagement manager. Cindy actually is holding two parts today. She's part of the member engagement team, and she is also one of our guest speakers. So Cindy is going to share information with us about the Consumer and Family Advisory Committee, also known as CFAC. And joining her to share about that is Janet McDaniel. And Janet is vice chair of our partners CFAC. Janet has a 28-year-old daughter with a developmental disability who lives at home with her and her husband. And Janet is also an adjunct professor in the Department of Religious Studies at UNC Charlotte. So welcome, Janet, as one of our guest speakers. We also have Dr. Leah Williams. Dr. Leah Williams is part of our population health team here at Partners, and she is going to be sharing information about the Health Equity Committee. And next we have Bonnie Stanford. Bonnie is our Consumer Rights Officer, and she is going to be sharing information about our Human Rights Committee. And last but certainly not least, also part of our member engagement team is Angela Griffin. Angela is our member operations manager, and she is going to be sharing information with us today about the new committee, Long-Term Services and Supports Stakeholder Advisory Committee. That is a mouthful. But Angela's going to give you some great details on that. And then also, Beth, why don't you go ahead and put that slide deck up, and I will share some housekeeping information with everybody. Just to let you know, today's session is being offered in closed captioning. If you don't need this feature, you can simply hover over the live transcript on your screen and click Hide Subtitle. I also want to let you know that this session is being recorded. So please don't share any sensitive or personal information during our session. If you do have information that you need to share and talk about member engagement, we would be glad to spend some time with you, so you can reach out to us and talk, or you can reach out via email to help you out with that. The recording and the PowerPoint slides will be available after our session. That's always a question when we get together. So I know when a lot of times when we listen to presentations, questions come to mind. If we don't get that question out right away, we might forget. So please feel free to use the Q&A feature. You'll find that at the bottom of your screen. It's towards the center. It says Q&A, little bubbles there. You want to click on that and you can enter your questions. And when we get to our question and answer time, we're going to go ahead and moderate those questions for you. If you do want to, if you prefer to ask your question via the microphone, you can just raise your hand at that time using the reaction feature at the bottom of the screen. And we will call on you and you can ask your question in that way. All right, so before I turn it over to Cindy as a guest speaker, just to those of you, if you're not familiar with Partners Health Management, we are a managed care organization. We have a contract with the state to administer North Carolina Medicaid funds and other state funds for services that support behavioral health. And when you think of the words behavioral health, think of mental health, substance use disorder, all of those things in that arena. We also support intellectual and developmental disabilities and traumatic brain injury. So now I would like to hand it over to Cindy Trobot, our first guest speaker.
Good afternoon, everybody. Like Ann said, I am Cindy Trobot, Member Engagement Manager with the Member Engagement Team at Partners. And also I have the opportunity to be the liaison to a couple of the committees that we'll talk about today. So today we're going to talk about the committee opportunities where members, family members, and in some circumstances, stakeholders and providers have opportunities to be on committees with partners and have a voice. And so we're going to talk about those opportunities. We'll go over each of those committees and how people can get involved. And at the end, we'll share with you who to contact. So if you're wondering who can participate, so as we go over each of the committees, we'll tell you who sits on those committees and what their roles are. And so any member or recipient or family member can attend any of the committees and listen in. And if you're interested in joining, we'll give you information about who to contact. So there may be an application process. There may be some other things that you would need to do to apply. There are circumstances where we'll share with you if there are capacities or limitations, or there have to be certain positions filled, but we'll let you know how you can participate and how you can join. The committees are really designed to safeguard and make sure that member and recipient point of views, perspectives, and their experiences are not only heard, but incorporated into the workings of Partners so that your feedback directly helps us to ensure a high quality and a person-centered approach to care. So we'll move on to the next slide. So today you will hear about these 6 committee opportunities at Partners. So we'll go over the Consumer and Family Advisory Committee, or CFAC. We'll go over the North Carolina Innovations Waiver Stakeholder Committee, the Tribal Advisory Committee, Human Rights Committee, Long-Term Services and Supports, or LTSS, Stakeholder Advisory Committee, and the Health Equity Council. Now, Janet McDaniel and I will be telling you a little bit about CFAC, and so I'm going to turn it over to Janet, and she and I are going to go back and forth on a few of these slides to tell you about CFAC. So I'll turn it over to Janet.
Hi, thank you, Cindy. So I'm the Vice Chair of Partners Consumer and Family Advisory Committee, CFAC for our short acronym. And I'm one of those voices, and I really enjoy being on the committee, and I think it's a great partnership that we have. So CFAC is a local self-governing and self-directed committee to ensure effective, successful, and meaningful collaboration in the development and management of the mental health, intellectual developmental disabilities, substance use disorder, and traumatic brain injury services system. We can move to, Cindy, back to Cindy.
Okay, thank you, Janet. So CFAC has a relational agreement with the Partners Board of Directors. And so what that means is there is an agreement, a written agreement and binding that outlines the information that goes back and forth between the board and CFAC. So it ensures members have input and feedback directly to our board of directors. So it's a really important position and seat to have to be able to monitor what Partners does and provide input into that process. So they have the voice directly to the board of directors. It also outlines how a means of communication between the two parties, between CFAC and the board, and also has a process outlined in there for resolving any disputes between the parties. Glad to say that we don't have any disputes or haven't had any that I'm aware of, but there is a process in the relational agreement for that. It's also good to know that 3 CFAC members also sit on our board of directors. So we have great participation in that. And one of our board of directors, CFAC members, also sits on a subcommittee for the financial subcommittee. So they are taking a look at all the workings of Partners and providing input into those processes. We'll move on to the next slide. Thank you.
So who can be a member? What are our requirements for membership? So the CFAC bylaws govern the membership selection, numbers and terms of service, and several other procedural matters. Each disability group is equally represented on our CFAC, and CFAC reflects as closely as possible to the racial and ethnic composition of the catchment area that they represent. So who can be on? Adult members and or adult family members of individuals with mental health, substance use disorder, intellectual and developmental disabilities, traumatic brain injury, and co-occurring physical health services. 1 representative from each disability area per county. So there's 4 members in each county, and 1 that represents each of these 4 areas. And at least at the moment, Partners CFAC membership capacity is 54 members, and we are not there yet. So we certainly need more representation. Once someone is a member, the term is 3 years, and which can be renewed, but then you can't serve more than 3 consecutive terms. So that's 9 years altogether one can serve. I feel like we skipped a slide here. So, okay, we went back and then forward. So what are some member responsibilities? CFAC members like myself share the community's voice and needs to help identify and develop customer service oriented services and supports. And I think this is a very important component of what we do. CFAC also sets goals to address our local issues and concerns, and also to monitor the work of partners. Members also participate on various local, state, and agency committees to help improve the public behavioral health system. And continuing with our member responsibilities, CFAC representatives take part in internal partner committees and community forums that focus on quality improvement activities, clinical outcomes, authorizations, payment, and other service data, contract deliverables. We help identify service gaps and underserved populations. There's a service array, development, delivery, and system change issues. And we also have an area authority budget. Cindy? I'll turn it back to Cindy now.
Thank you, Janet. In addition to all of that Janet just shared with you, as we move towards tailored plan, We will also be addressing with our CFAC committee those physical health issues under medical and pharmacy, in addition to what they currently cover for behavioral health and intellectual and developmental disabilities and traumatic brain injury and substance use disorder. They will be taking a look at issues of the social determinants of health with the Healthy Opportunities programs. There's a pilot where what that means is that we will be offering services to folks where we are looking at other resources they might need as far as their housing needs or food, transportation. Our care management helps with assessments for those types of things, but our CFAC committee will include those in future discussions as well. So just to wrap up this section before we move to the next committee, at the end, we're going to share information about contact information. So if you're interested in serving on CFAC, we do have on our website, we have a list of vacancies in those counties that Janet was referring to, where we can have 4 members on CFAC from each of our 14 counties up to 54 members. And so one of the vacancy needs that we have across the catchment area is in traumatic brain injury. So, but we do have some other vacancies in some of the other counties, and that list is on our website as well as the application. So if you have any questions, we will share my contact information, Cindy Troba, at the end of the presentation, where you can reach out to me if you're interested in joining CFAC and have any questions. So we can move on to the next committee. All right, so here we have the North Carolina Innovations Waiver Stakeholder Committee. This committee makes recommendations regarding implementation and operation of the Innovations Waiver services and policies, and that's per the North Carolina Medicaid contract that we have with partners, between partners and the Medicaid office. So next we will share information on this committee and tell you, if you're interested, how you can join that. So we'll go to the next slide. Okay. So as I said, the North Carolina Innovations Waiver Stakeholder Committee exists to make recommendations regarding implementation and operations of the Innovations Waiver. So it's very specific. Typically, members, family members, stakeholders, and providers are on this committee and advise us as to the operations of that waiver services and policies. The committee has an assigned care management support. So in our IDD care management department, we have several representatives who come to that committee and provide updates and share information with those families regarding the Innovations Waiver. We'd like to encourage anyone who receives services under the Innovations Waiver, if you're interested in participating, you are welcome to apply to participate, and you can reach out to me as the liaison for that committee as well. The next committee we'd like to talk to you about is the Tribal Advisory Committee. The tribal liaison is Shelby Holland, and she's actually in Cherokee this week to meet with the leaders about and tour their facilities. So she wasn't able to be here today with us. You'll catch her next month at our next member cafe. She'll join us. But this committee will provide guidance and support to the partner staff on local cultures and norms, the best ways to approach members, the best way to market materials to members, and address needs and gaps, and also training recommendations. This committee is fairly new, and it is going to be very specific on who will serve on this committee. So this committee will be comprised of tribal leaders and members from the federal and state tribes. They will discuss barriers to treatment, transitions between plans, and cultural issues. They will typically communicate regularly by email, but they are required to meet semi-annually. There'll be more information coming out since that one's fairly new. So we'll be getting more information out about Travel Advisory Committee. All right, so now I'm going to turn it over to Bonnie Staniford, who's going to tell you about the Human Rights Committee.
Good afternoon, everyone. The Human Rights Committee protects the human rights of individuals receiving services, including their right to dignity, privacy and humane care, and freedom from mental and physical abuse, neglect, and exploitation. And so for the HRC, or the Human Rights Committee membership, the members consist of individuals receiving services, family members of those individuals, board members, and advocates. The Human Rights Committee members also have an opportunity to influence increased quality of care for those individuals that are receiving services by ensuring that their rights are being upheld during treatment and recovery. And the committee meets quarterly, once every 4 months. But most of what the Human Rights Committee does is to ensure that the members that are being served, that none of their rights are violated and that their rights are being upheld during treatment and recovery. The responsibilities as a member on the Human Rights Committee, each of the members must be willing to receive training for their role on the committee. We do try to provide training 2 or 3 times a year at least, and they will sign the partners' confidentiality agreement, attend all of our scheduled meetings, and make efforts to be informed about issues affecting persons with disabilities. There again, it's important for our committee members to stay abreast of all the changes that are going on that could affect the quality of care and the rights of those individuals receiving services. The HRC members also must be open-minded. They must be tolerant and open to diversity. It's important also that they do not serve on any other partner members' recipient committees, so we can allow for more participation from others in each county. Right now, the Human Rights Committee, we do have openings for other members, especially in Burke County, Gaston County, Iredell County, Surrey, and Stanley counties. So if you live in one of these areas and you are a family member or someone that you advocate for, if you're interested in joining this committee, we'll have information at the end of this how you can join. And at any time, you can also contact me, and I'll be happy to assist you with how to join. Continuing with the responsibilities, as informed advocates, the Human Rights Committee members should ensure an individual's rights are being met in compliance with Article 3 of the North Carolina General Statute 122C. Establish processes to discuss, review, and monitor concerns, grievances, complaints, and alleged member or recipient right violations. Ensure restrictive procedures and plans do not violate human rights. Address failure to provide needed services available in the partner's service area, and assist in producing the annual report for the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Use section. And so these last 5 bullet points really has a lot of information in there that's very pertinent to what the Human Rights Committee is involved with. Looking back over that, we do monitor any concerns, grievances, or complaints that comes in. against an alleged member or recipient's rights violation. The restrictive procedures, anytime that there's a restrictive procedure done, it is reviewed to make sure that their rights are not being violated. We also address if their services are being provided. So failure for backup services, we look into those things as well. And as the last bullet point says, we do provide an annual report to our board of directors to be included in that North Carolina Division of Mental Health Developmental Disability Substance Use section of the annual report. Okay, that's all I have regarding the Human Rights Committee. And so again, just give me contact me if you have any questions at all or interested in joining the Human Rights Committee. And at this time, I'd like to turn it over to Angela Griffith, who will be going over our next committee.
Good afternoon, everyone. Thank you for this opportunity to discuss the Long-Term Services and Support, otherwise known as LTSS Stakeholder Advisory Committee. Partners has established the LTSS Stakeholder Advisory Committee per North Carolina Medicaid contract requirements for North Carolina Medicaid Direct and Partners Tailored Plan. Next slide, please. So you may be asking, what are some examples of LTSS? Examples of LTSS are home and community-based services, personal care services, hospice, and home health services such as skilled nursing, specialized therapies, home health aides, or medical supplies. The LTSS Stakeholder Advisory Committee membership will reflect the LTSS population or their representatives and will include members accessing LTSS services, representatives of LTSS members, LTSS providers, care managers from advanced medical home plus practices, and care management agencies serving LTSS members, and partner staff involved in the authorization of LTSS and or care management of LTSS members. It is important to note that 51% of the committee membership must be members. Next slide, please. So what are the responsibilities of LTSS members? The committee members will have a strong understanding of the needs of the LTSS members. Members will also gather stakeholder input and advice regarding LTSS. Members will need to attend the quarterly meetings. During these quarterly meetings, LTSS member experience and quality of care will be reviewed, and this will serve as an early warning system for emerging issues. Next slide, please. To support the LTSS Stakeholder Advisory Committee, Partners designates a single point of contact, the LTSS liaison, that would be me, to be responsible for communication and coordination of concerns related to the quality of care related to LTSS. Care managers, other member services, and provider relations staff will report concerns related to quality of care delivered to members receiving LTSS to me, the liaison, who will coordinate resolutions with the member's family, the North Carolina Department of Health and Human Services Long-Term Care Ombudsman, Medicaid Managed Care Ombudsman Program, or CFAC as appropriate. Please spread the word for this newly formed committee, and we look forward to a successful collaboration with our members, their representatives, and stakeholders. Now I am going to turn it over to Dr. Leah Williams to discuss the Health Equity Council.
Thank you, Angela. Thank you so much. Good afternoon, everyone. I'll be speaking with you this afternoon about our Health Equity Council. This is a newly formed council at Partners. We've just been operating for this year, the year of 2023. So the Health Equity Council is centered around our efforts at Partners in achieving health equity for all of our members and recipients. At Partners, we value every member and recipient equally, and we're focused on attaining the highest level of health for our entire population and eliminating health disparities, eliminating disparities in health and healthcare. Next slide, please. So the Health Equity Council aligns with the Healthy People 2030 goals. One of those goals includes eliminating health disparities, achieving health equity, and attaining health literacy to improve health and well-being for all. So according to the Centers for Disease Control, the definition of health equity is defined as health equity is achieved when every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. Next slide, please. So our Health Equity Council works on several different things, and you can see those listed here. The Health Equity Council works on various projects related to identifying and analyzing health disparities by reviewing various data, utilization or quality data. The council addresses stakeholder representation and engagement, improvement opportunities, identifying areas of improvement related to diversifying staff, especially those in leadership positions, developing new initiatives that will address health disparities, and then finally examining existing policies that can be amended or improved around health equity and reducing health disparities. Next slide, please. So just some general information about the Health Equity Council. As I mentioned before, it's a newly formed council. We started in January of this year, so we're coming to the close of our first year with our Health Equity Council. So council members serve a one-year term or volunteer to be a part of the council for 1 year, one calendar year. Membership for this council for 2023 consists of about 20 individuals from community stakeholders that include individuals who receive services, service providers, educators, partners and advocates from various industries. The Health Equity Council reports up directly to our CEO, and we meet quarterly. So our next meeting or final meeting of this year will be the second week in December. So we will be looking for new individuals who are interested in joining our Health Equity Council as we look towards starting a new year in 2024. So if you're interested in participating, please let me know. I'll drop my information in the chat. Thank you so much.
So you heard from several of our speakers today. So in conclusion, the committees are available to members and recipients and their families and community stakeholders. So you heard about our CFAC, which is Consumer and Family Advisory Council. You heard about the North Carolina Innovations Waiver Stakeholder Committee, our Human Rights Committee, our Long-Term Services and Supports Member Advisory Committee, and our Health Equity Council. So all of these councils are important in, as we move forward and support our members in the community. All stakeholders are encouraged to get involved and to voice the needs of our members and recipients and have an impact on behavioral health, intellectual and developmental disabilities, traumatic brain injury, and physical health service, the physical health service delivery system. So we really welcome you to join us if you're interested. So go ahead and move to the next slide, Beth, and I'm going to share all of the contact information. So first we have our CFAC and Cindy Trobaugh, who presented to you today. She is our CFAC liaison. The phone number is there for you, as well as an email address. And again, this slide deck and the recording will be available. We'll send it out to you via email after our presentation. So the second one is the North Carolina Innovation Stakeholders, and Cindy is the contact for that one as well. You heard about our tribal advisory, and Shelby Holland, who was not able to join us today. She is the liaison to that committee. So if you're interested, you can reach out to Shelby. Her email address and phone number are there. Bonnie Stanifer shared information about our Human Rights Committee. Super important for all of our members to ensure that their rights are being respected and they're receiving everything that supports that they need. You can reach out to Bonnie. Her email address is there and phone number if you're interested in being part of the very important Human Rights Committee. And then 2 more to go, long-term services and supports. You heard from Angela Griffin, our member engagement operations manager. She is your liaison to the LTSS committee. There's a phone number there for you and an email. And last, but certainly not least, our health equity committee. You heard from Dr. Leah Williams, and she is your contact for that committee as well. So I really hope that you will be reaching out to be part of these important committees. And so now we've reached the time in our session for question and answer time. So if you haven't entered any questions that might have come to mind into the Q&A, now's your chance. So go ahead and pop those questions in there, or you can raise your hand and Beth will unmute you and you can share your question or comment with us. So here we are, Q&A time.
Okay, I'm going to give my fellow panelists just a moment to get their cameras prepared, and we will come on our cameras and answer any questions that you have.
Well, all is quiet. Must have been really great information. Didn't prompt any questions. That means you got all the details that you needed, which is great. So I really want to thank our guest speakers for doing such a great job. I'm going to give you one more chance to throw some questions in there. All right. So if that be the case, we have, a little less than 20 minutes left. So let me go ahead and share some information about Partners Health Management with you. So Beth, you want to pop some of those slides back up?
Give me just a moment to
Sure.
get that slide deck prepared.
So while Beth's doing that, I just want to remind you that we are going to send the slides out in the recording. And if you have any questions, feel free to reach out to any of our guest speakers about the committees. You can also reach out to our member engagement team. We're familiar with each one of these committees and could maybe answer your questions or get you directly connected to the liaison. So thank you, Stacy. So Stacy popped the information about contacting our member engagement team right into the chat for you. So super easy to copy and paste. All right, thanks, Beth. We've had a slide deck with a mind of its own today. So let's see if we can get it going in the right direction. All right, so I shared a little bit of information earlier with you about Partners Health Management. So our mission is to improve lives and strengthen communities. And we do that by managing a contract with North Carolina Medicaid and offering services through a network of providers. So when you receive treatment, you won't see folks from partner staff, but you'll actually be connecting to our providers who have expertise level in the arena of mental health, substance use, intellectual disabilities, and traumatic brain injury. So currently we manage North Carolina Medicaid Direct. We are also managing the 1915I option. It was approved July 1st of this year. It is still in the mode of getting up and running, but we are definitely managing the 1915I. We also have a 24-hour-a-day, 7-day-a-week crisis call center for behavioral health concerns for mobile crisis. And you'll see that phone number later on in our slide deck before we end today. It's a newer number. And then I'm sure you all know that we will soon be managing the tailored plan, which is anticipated to start sometime during the first half of 2024. All right, and these are the 14 counties that we currently serve. You can see them listed there on your screen, so I won't read them out loud for you. Let's go ahead and go to the next slide, Beth. All right, Member Connect. I wonder if any of you have tried out Member Connect. So what is Member Connect? It is our member portal so that you can log in as a member or perhaps a guardian of a member or a legal representative to access information and possibly request information. So you go to the partners website, and right in the upper right hand corner, you can see it circled there in red. You just click on Member Connect. And once you click on that, you can go ahead and go to the next slide. Once you click on that, it'll enable you to create an account if you haven't already done so. And so it's going to give you some information there. You're going to put the member's name in and their Medicaid ID number. There'll be information on there to get assistance to do so. Once you log in, this is the home screen to Member Connect. Member Connect is an ever-changing product. It keeps getting better and better each day. You'll be able to access things here like quick access to your member handbook, quick access to information about how to file a grievance. You'll also be able to do a health screening. It could be a mental health screening. These are screenings that you can do yourself and they are confidential. It's a great resource and tool that's on our website. You'll also be able to search for providers for both behavioral health providers. And then as we move forward to tailored plan, you'll be able to search for physical health providers as well. As we do get to that tailored plan stage, you'll be able to utilize Member Connect to request a new Medicaid ID card, to perhaps change your primary care provider or your tailored care manager. So that's just some of the highlights of Member Connect. So now let me talk a little bit about transition of care. So we have several MCOs across the state, and there are also different health plans, such as the standard plan. We manage Medicaid Direct, which is for those individuals who have additional mental health and behavioral health needs. And the standard plans really serve the majority of people who have Medicaid across North Carolina. Sometimes there is a reason to transition between health plans. And what I want you to know is that we have a team here at Partners managed by Angela Griffin, who spoke earlier today, and their team will provide just a lot of help and hand-holding to get you transitioned, either from one managed care organization to another. Perhaps you moved from one county to another and you're moving to another MCO or a managed care organization. Or maybe your Medicaid status has changed, your service needs have changed. So all different reasons. So there's a couple of different ways that you can make that happen. What I want to tell you is the best way to make that happen is to reach out to your service provider or your health plan, and they can get that transition started for you. You can also reach out to the North Carolina Medicaid Enrollment Broker. There's a link right on the screen there, and Stacy's dropping that right into the chat for you. There's also a phone number that you can call, and they can help you with that process as well. Either way, any way that you do it, we are here for you at Partners to help you with that transition. All right, member engagement. You heard me talk about that earlier. So the member engagement team is here for you. We're here to help you navigate our service system. If you don't know which way to turn, who to talk to, member engagement is a great place to come to. We can help you navigate our service system, whether it's for intellectual disabilities, substance use disorder, mental health, traumatic brain injury. We're here for you. We're gonna listen and get you to the right place to meet your needs. So when we go over to this next slide here, right there in the center is our phone number, 704-884-2729. That goes to a member engagement specialist call line. And that call line pops over to our different member engagement specialists throughout the day. So you should be able to talk to someone live. If you're not, it's going to hit a voicemail and we should get back to you within 24 hours. If you're a person that prefers to communicate by email, you can do that too. So you're just going to email memberquestions@partnersbhm.org. So give us a call. We want to make sure that we hear your needs. Another thing I want to tell you about is the Pix Health mobile app. If you haven't heard about that, I really encourage you to give it a try. It's a great app, super simple to get it downloaded on your phone. Right there in the center, you can see, you can go to highpix.com, or you can give Pix Health a call at 855-499-4777, and they can help you out. So this app lets you interact with that cute little chat bot you can see on the screen. His name is Pixar, and it has some let's try that one more time. Self-screening tools to help you monitor your mental health, and it really focuses on loneliness. So there are a lot of activities on there that you can access. There's also a compassionate call center where you can talk with someone, peers that have experienced mental health issues and can help you get the support that you need. They often give us referrals here at Partners so that we can support you as well. So the Pix mobile app, if you are a member for Partners Health Management, you can receive a $10 gift card for downloading the Pix Health mobile app. So it's a great tool. I encourage you to give it a try. So one other thing I wanted to let you know is who do you call? Who do you call if you need some assistance? So if you're currently receiving services, you want to go to your provider, the agency that is providing treatment or service for you. They're your first responder in a crisis. You want to reach out to them. Or you can call your Partners care manager if one is assigned to you. If you're not in services and you have general questions, you can call our member engagement line. I just shared that with you. It's right there in the center of the screen again. And then, of course, we have our member services line, which is 888-235-4673. And that number is available to you Monday through Saturday from 7 a.m. to 6 p.m. And here's our call lines for you. That first one I was just mentioning is the first line there, our member and recipient services line. And right there in the center is our behavioral health crisis line. That's the number that I need to remember better, 833-353-2093. This line is available 24 hours a day, 7 days a week. It's available to anyone. On this line, you'll be able to connect directly with a clinician to support you in need of crisis. It also can connect you to a mobile crisis team that can come out directly to you. So the behavioral health crisis line, 833-353-2093. And then at the bottom, there's our provider services number. This number is available to our provider agency. Those are those experts that provide treatment to our members. And that number is available to our providers Monday through Saturday, 7 a.m. to 6 p.m. Monday through Saturday. All right, and if you haven't heard about the new suicide lifeline number, that is 988. It's a crisis line. It launched in July of 2022. It's available 24 hours a day, 7 days a week. You can call, text, and it has chat access as well with trained crisis counselors. And it offers help for people experiencing suicidal thoughts or other behavioral health crises. It has translators in Spanish and offers TTY for deaf and hard of hearing. So last but not least, I want to encourage you to stay in touch with us. It is super important to keep your contact information up to date, especially during this time when we have so many changes going on with our Medicaid system. The Department of Social Services, if you have Medicaid, is the keeper of this information. So if you move, your phone number changes, you're going to want to contact your local Department of Social Services to update your information. If you don't have Medicaid and you do receive state funds from Partners Health Management, you can call our Partners Access line, which I mentioned earlier, that 888-235-4673, and update your contact information if it changes. All right, so if you want to stay in the know and stay connected, we often send out emails with information or perhaps information about a session such as Member Café. We have other training sessions as well. You can grab that QR scan code right there on your screen or grab the link that Stacy is dropping into the chat to get signed up and subscribe to our emails that go out. And here is the very last thing, and this is where we need your help. Your feedback is so important to us. If you could please take a moment to complete our survey. It won't take very long. There are very few questions, but this is really helpful to us. This is your opportunity to share with us about what topics you would like to hear about in the future, because we really would like to know how we can continue to provide information for you. There's also a link there that is on the screen and also been dropped into the chat. So I believe that this is the end of our information for today. So this is your very last opportunity to ask any questions you might have. Our Q&A is still open, and we're all here still to answer any questions you might have. But you all have been so quiet today, but we really appreciate you being here and spending this hour with us today. I hope that you've gained some information about our advisory committees and can give them some thought and maybe join us as we work together to improve lives and to support our communities. So again, thank you all for joining us today. I'm giving you just a few minutes back in your day. So enjoy the rest of your day. All right, thanks. Bye, y'all.